welcome to Farmer Learning. In this lecture, we will learn about non-steroidal anti-inflammatory drugs.
These agents are also known as non-narcotic, non-opioid or aspirin-like analgesics. They act primarily on peripheral pain mechanisms, but also in the central nervous system to raise pain threshold. They are more commonly employed, and among from them many are over-the-counter drugs. They have additional properties such as antipyretic and analgesics, which are chemically diverse. But most of them are organic acids. These agents are classified in 4 broad categories: non-selective cyclooxygenase enzyme inhibitors, preferential COX-2 inhibitors, highly selective COX-2 inhibitors, and analgesic antipyretics with poor anti-inflammatory effect.
Non-selective enzyme inhibitors are further lists. Propionic acid derivatives, acetic acid derivatives, phenamic acid derivatives, pyrrolopyrrole derivatives, oxycam derivatives and indole derivatives. Aspirin is salicylate compound. Ibuprofen, ketoprofen, naproxen and flurbiprofen are propionic acid derivatives. Diclofenac and aceclofenac are acetic acid derivatives. Phenamic acid derivatives is mufnamic acid. Ketorolac and etodolac are pyrrolopyrrole derivatives. In oxycam derivatives there are piroxicam and tenoxicam. Last, indomethacin is indole derivatives. Preferential COX-2 inhibitors are nimesulide, meloxicam and nebumetone. Highly selective COX-2 inhibitors are etoricoxib, varicoxib and lumiracoxib. Whereas analgesic antipyretics with poor anti-inflammatory effect is classified in 3 classes as paraaminophenol derivative, pyrazolone derivatives and benzoxazosine derivative. Paraaminophenol derivative is paracetamol, which is also known as acetaminophen. Pyrazolone derivatives are metamizole and propylphenazine. Benzoxazosine derivative is nefobam. NSAIDs are used as analgesic and antipyretic. Also used in treatment of rheumatoid arthritis, acute rheumatic fever, osteoarthritis and thromboembolic disorders. They are also useful for medical closure of pedent ductus arteriosus, in which indomethacin is preferred. In colon and rectal cancer, aspirin is reported to reduce the risk and retard the onset of Alzheimer's disease. To control radiation-induced diarrhea. To control pruritus and flushing associated with the use of nicotinic acid. Adverse effects of NSAIDs are salicylate poisoning, in which with higher doses, salicylism occurs, characterized by tinnitus, decreased hearing, vertigo, headache, confusion, lassitude, drowsiness, hypothermia, sweating and thirst, at toxic doses, respiratory alkalosis and later acidosis, depressed cardiac function and peripheral vasodilation, gastric intolerance, gastritis, upper gastrointestinal bleeding, vomiting, Reye's syndrome. Use of salicylates in children with viral infection may cause hepatic damage with fatty infiltration and encephalopathy, called Reye's syndrome, hepatitis, bronchoconstriction and shocks, occur in patients with asthma and nasal polyps. Thanks for watching. Farmer Learning.